What happens if your body is deficient in omega-3? Omega-3, you've probably heard this name in dietary supplement commercials or from doctors' recommendations. But do you really understand the role of omega-3 and what happens if your body lacks it? This article will help you understand clearly, remember easily, and apply practically in daily life. What is omega-3? Omega-3 is a group of essential unsaturated fatty acids, meaning our body cannot produce them on its own and must obtain them from food. There are three main types. ALA, alpha-linolenic acid, commonly found in plant sources like flax seeds, chia seeds, and walnuts. EPA, eicosapentaenoic acid, mainly found in fatty fish such as salmon, mackerel, and sardines. DHA, docosahexaenoic acid, especially important for brain and vision health, found abundantly in deep-sea fish. The role of omega-3 in the body. Omega-3 doesn't just protect your heart, it plays a crucial role in many vital functions, reduces inflammation. Omega-3 helps control inflammatory responses, a factor contributing to many chronic diseases such as heart disease, diabetes, and arthritis. Heart health. Omega-3 helps lower blood pressure, reduce bad fats, triglycerides, and prevent blood clots and plaque buildup in the arteries. Brain and vision development. DHA, a form of omega-3, is highly concentrated in the brain and retina, crucial for brain and vision development in children and maintaining cognitive function in older adults. Mood support. Studies show that omega-3 can help improve mood, support people with mild depression and anxiety. Skin health. Omega-3 helps keep the skin moisturized, reduces dryness, and helps prevent premature aging. Joints and immune system. They act like silent heroes, fighting inflammation, improving blood circulation, enhancing mood, boosting memory, maintaining healthy skin, and even helping stabilize blood pressure. 3. Signs your body is deficient in omega-3. Omega-3 deficiency doesn't usually cause loud or dramatic symptoms right away. However, if you listen carefully to your body, you might notice the following silent signals. 1. Dry skin and brittle hair. Omega-3 helps retain skin moisture and elasticity. When deficient, skin may become dry, flaky, or mildly inflamed. Hair may become weak, break easily, and appear frizzy. 2. Frequent fatigue, low energy. Omega-3 plays an important role in cellular energy production. When lacking, you may feel chronically tired, sluggish, even after a good night's sleep. Work performance and concentration may decline. 3. Mood swings, anxiety, and mild depression. Studies show a lack of omega-3, especially DHA, directly affects neurotransmitter function, increasing feelings of anxiety, irritability, or even mild depression. Older adults with omega-3 deficiency may face a higher risk of memory loss and dementia. 4. Joint pain and mild inflammation. Because omega-3 naturally has anti-inflammatory properties, when it's lacking, you may experience joint pain or stiffness in the morning. Some people may develop mild inflammation in the skin, mucous membranes, or digestive system. 5. Rapid heartbeat or irregular rhythm. DHA and EPA help maintain stable heart function. Without enough omega-3, you may experience irregular heartbeat, unexplained palpitations, or a slight increase in blood pressure. Some may feel heart fluttering or pounding without a clear cause. Note, these signs aren't specific to omega-3 deficiency alone. However, if you experience 2 to 3 of these symptoms, especially when your diet lacks fatty fish or omega-3 rich seeds, it's important to get checked and consider supplementation. Part 4. Causes of omega-3 deficiency. Many people believe that only those with poor diets lack nutrients, but in reality, omega-3 deficiency can occur even in those who eat 3 meals a day. So why does the body fall into a state of lacking this essential fatty acid? One, diet low in omega-3. The most common cause is not consuming enough omega-3 rich foods. For example, cold water fatty fish like salmon, sardines, and mackerel, rich sources of DHA and EPA, are not commonly found in the daily meals of many Vietnamese people. Plant-based sources of ALA like flax seeds, chia seeds, and walnuts are often forgotten in daily meals due to habits that favor starch and red meat. 2. Excessive omega-6 intake. Omega-6 is not inherently bad, but when the omega-6 to omega-3 ratio becomes imbalanced, e.g., 20:1 instead of the ideal 4:1, omega-6 can inhibit the absorption and conversion of omega-3. Industrial cooking oils, like soybean, sunflower, and corn oil, are high in omega-6. Consuming lots of fried and processed foods also severely disrupts the ratio. 3. Poor digestive absorption. In the elderly or those with digestive issues, such as colitis, chronic digestive disorders, the body struggles to absorb healthy fats, including omega-3, digestive enzymes and bile, which help break down fats, also decline with age, leading to prolonged deficiencies even with a balanced diet. For stressful and sedentary lifestyle, prolonged stress not only affects mood but also increases inflammation, raising the body's need for omega-3 without sufficient supplementation. Meanwhile, physical inactivity slows down metabolism, reducing the efficiency of omega-3 conversion and utilization. 5. Groups more prone to omega-3 deficiency. Elderly people. Their ability to synthesize and absorb nutrients declines with age. Strict vegetarians. They don't consume fish or eggs, the primary sources of DHA and EPA. Pregnant breastfeeding women. Their omega-3 needs increase significantly, but deficiency is likely without proper supplementation. Quick conclusion: understanding the causes of omega-3 deficiency is the first crucial step in preventing it and adjusting dietary habits, not just to improve health, but to protect your heart, brain, and skin from the inside out. Part 5. How to supplement omega-3 properly. Once you know your body lacks omega-3, the next question is, how can I supplement it effectively without overdosing or experiencing side effects? Below are key principles for supplementing omega-3 correctly, safely and appropriately for different individuals. 1. Prioritize natural food sources. Omega-3 comes in 3 main forms: ALA, alpha-linolenic acid, from plants, flax seeds, chia seeds, walnuts; EPA, eicosapentaenoic acid, mainly from fatty fish; DHA, docosahexaenoic acid, mainly from fatty fish and eggs. Although ALA is a good plant source, only about 5 to 10% is converted into EPA/DHA by the body. Therefore, fatty fish like salmon, sardines, mackerel, and herring should be eaten at least 2 to 3 times per week. Vegetarians can choose algae oil, a highly effective plant-based DHA source. Pushpin suggested omega-3 meal plan for the week: breakfast, oats, ground flax seeds, plant-based milk; lunch, pan-seared salmon, steamed vegetables, brown rice; dinner, walnuts, salad, olive oil, boiled eggs. Two, use supplements when needed. For people who don't eat fish or need higher intake, e.g., those with heart conditions, pregnant women, omega-3 capsules are a convenient choice. Magnifying glass tilted right when choosing omega-3 supplements. Choose products with clear DHA and EPA labeling. Prefer lightly flavored, non-fishy, burp-free, and easy-to-digest capsules. Look for brands tested for quality and certified mercury-free. Light bulb recommended daily dosage. Healthy individuals, 250 to 500 milligrams EPA DHA/day. Those with cardiovascular disease, 1000 to 2000 mg/day, under doctor supervision. 3. Best time to take omega-3. Take omega-3 during or after a main meal, with fat, for optimal absorption. Avoid taking on an empty stomach to prevent digestive discomfort. 4. Combine with a healthy lifestyle. Omega-3 supplementation is more effective when combined with reducing omega-6 rich oils, cut down on fried foods and refined vegetable oils, increasing physical activity to enhance fat metabolism, managing stress, since prolonged stress raises the body's need for omega-3. In summary, supplementing omega-3 isn't difficult. The key is choosing the right source, using the right dose, and maintaining a healthy lifestyle. By taking care of your meals, you're gradually building the foundation for a healthy heart, sharp mind, and resilient body. Part 6. How much omega-3 is enough? Proper omega-3 supplementation isn't just about whether or not to take it, but more importantly about how much is appropriate based on your condition, age, and health status. Too little won't be effective, too much could be harmful. So what's the right dosage? Let's explore by group. 1. Healthy adults. White heavy checkmark WHO and global nutrition recommendations. 250 to 500 mg/day EPA DHA is the basic dose to support cardiovascular, brain, and vision health. White heavy checkmark. This can be achieved by eating fatty fish at least twice a week, or taking fish oil capsules if diet is lacking. 2. Pregnant and breastfeeding women. Light bulb. This group needs more DHA to support fetal and infant brain and eye development. DHA 200 to 300 mg/day, ideally combined with EPA. Some experts recommend at least 500 mg per day total EPA DHA. Pushpin note: choose purified fish oil, free of mercury and other toxins. Three. Children and adolescents, 0 to 12 months, around 500 mg per day ALA, via breast milk or fortified formula, 1 to 8 years, 700 to 900 mg/day ALA, 9 to 13 years, 1000 to 1200 mg/day ALA, if taking EPA/DHA directly, via fish or child-safe supplements. Do so only under medical or nutritional guidance. 4. People with heart disease, arthritis, depression. Clinical studies show 1000 to 2000 mg/day EPA DHA helps improve heart health, reduce inflammation, support mood, and lower depression risk. In special cases, e.g., high blood triglycerides, up to 4000 mg per day may be used, but only under medical supervision. Pushpin note: high doses may increase bleeding risk, especially when using anticoagulant medications. Consult your doctor. 5. Vegetarians and dieters. Supplement with ALA from flax seeds, chia seeds, walnuts, 1 to 2 tablespoons/day, or use algae oil capsules to directly provide DHA. Conclusion: omega-3 may be a small nutrient, but it plays a big role, vital to almost every system in your body. Deficiency can seriously affect both physical and mental health, especially in older adults. Backhand index pointing right. Don't wait for your body to speak up to realize you're lacking omega-3. Start today. With a little fish, a spoon of flax seeds, or a simple fish oil capsule, to nourish a strong heart, a sharp mind, and a resilient body. Are you getting enough omega-3 each day? If you're not sure, try adjusting your diet and observe how your body responds.